5 early signs of kidney damage you shouldn't ignore. The process of kidney damage is often silent. Were you aware that over 1 in 7 American adults suffer from chronic kidney disease? Despite this, 90% of those with chronic kidney disease, CKD, do not know they have it. Kidneys may slowly and quietly fail over 10 to 20 years before culminating in end-stage kidney disease, ESKD, at which point the kidneys have lost 85–90% of their functionality. Detecting kidney disease early is the best strategy for managing it. Typically, CKD presents no symptoms in its initial stages. However, early detection is based on abnormal lab results. We'll delve into these tests soon, but first, let's explore the early signs and symptoms of kidney disease that you can easily spot at home or with the naked eye. Please be aware that all information in this video has been meticulously verified, is unbiased, and reviewed by qualified professionals. Foamy urine 5. Foamy urine occurs when persistent layers of small to medium-sized bubbles are visible in the toilet. A single layer of large bubbles that dissipate quickly is normal. This can result from the force of the urine stream or other substances typically present in the urine. In chronic kidney disease, foamy urine is caused by proteinuria, which is the presence of protein in the urine. Proteins, such as albumin, are usually found in the bloodstream and should not appear in urine. However, they can if the kidneys are damaged. Albuminuria is one of the earliest indicators of kidney disease and can be observed as early as stage 1 CKD. Nonetheless, only about 1/3 of individuals who report foamy urine actually have abnormal proteinuria. Nocturia, or the need to urinate at night, often occurs alongside polyuria, which is the production of excessive urine that can occur with CKD. This excess urination may happen only at night or throughout the day. The disruption of salt and water balance in CKD can lead to either nocturnal or 24-hour polyuria. Age-related changes in circadian rhythms, which regulate the body's sleep-wake cycles, also contribute to nocturia. Other reasons for nocturnal urination include diabetes, prostate gland obstruction, pregnancy, urinary tract infections, and more. Nocturia is a preliminary symptom of CKD. Studies show that a decline in kidney function is linked with nocturia and corresponds with the frequency of nocturia episodes. Kidney function is assessed by how effectively the kidneys filter waste, known as the estimated glomerular filtration rate, eGFR. In a 2023 study, people with nocturia had a slightly lower eGFR than those without it. Are you enjoying our video so far? If so, please give us some hints by dropping a like, and we'll make more content like this. 3. Blood in the urine. Blood in the urine hematuria, or blood in the urine, may be visibly noticeable as gross hematuria, or invisible, referred to as microscopic hematuria. Early CKD might manifest through either type. If you observe urine that appears overtly bloody, red, pink, brown, or tea-colored, this could indicate bleeding. Unlike gross hematuria, microscopic hematuria does not change the urine's color and is generally detected through routine or incidental urinalysis. Urine dipstick and microscopic examinations can confirm suspicions of blood in the urine. A 2018 study found that microscopic hematuria in patients with moderate CKD indicated a heightened risk of disease progression and mortality within the first 2 years of testing. Participants were diagnosed with hematuria based on positive urine dipstick tests. The study also showed that hematuria prevalence increases as eGFR levels decrease. Decreased urination chronic kidney disease may also lead to decreased urine output or oliguria, though CKD itself seldom results in reduced urine production. Typically, acute kidney injury in someone with underlying CKD is the main cause. For instance, this might occur if you have a chronic urine outflow obstruction contributing to CKD, and then develop urinary retention with little to no urination. Other factors include severe dehydration, shock, or another cause of diminished blood supply to the kidneys. Flank pain. Flank pain, felt on the side of the abdomen between the ribs and the hips, is significantly more common in individuals with CKD than in the general population, often resulting from direct kidney involvement or related comorbidities. Chronic flank pain is a primary symptom of polycystic kidney disease. Other renal conditions that increase CKD risk and may cause chronic flank pain include kidney infections, inflammation, tumors, narrowing of the vessels supplying the kidneys, and other vascular abnormalities. Conditions outside the kidneys, like obstructions in the urine outflow pathway due to stones or congenital blockages, also predispose individuals to CKD and associated flank pain. If you are experiencing any of these symptoms, it's crucial to take steps to protect your kidneys and prevent further disease progression. Risk factors. How can I determine if I am at risk? The likelihood of developing CKD escalates if you have hypertension, diabetes, cardiovascular disease, heart failure, or a history of acute kidney injury, AKI. Hypertension and diabetes are the two predominant causes of CKD among U.S. adults, with approximately 1 in 5 individuals with hypertension and 1 in 3 with diabetes eventually developing the condition. Residing in an area with a high incidence of CKD or being exposed to certain environmental factors can also elevate your risk. Additionally, the risk is greater for those with other health issues, such as recurrent kidney stones, abnormalities in the urine outflow tract, Hawaii V, lupus, vasculitis, exposure to certain medications or radiation therapy, or a family history of kidney disease. The defining feature of CKD is a diminished kidney function sustained for at least 3 months. As the kidneys progressively lose functional tissue, there is a gradual decline over several years. Doctors classify this deterioration into 5 stages of CKD based on your estimated glomerular filtration rate, eGFR. Complications of CKD include accumulation of fluid and toxins in the body, elevated blood pressure, electrolyte imbalances, anemia, heart disease, and weakened bones due to low calcium and vitamin D levels. These complications give rise to symptoms observed in more advanced stages of CKD, such as fatigue, poor appetite, a metallic taste in the mouth, nausea, vomiting, weight loss, swelling around the eyes, legs, and feet, shortness of breath, and confusion. Early diagnosis. Which test can help you detect kidney disease early? A recent study evaluated individuals who met lab criteria for stage 3 CKD and found that an earlier diagnosis helped delay further decline in kidney function. This conclusion was supported by comparing lab values taken 2 years before and after the CKD diagnosis. Delays in diagnosis and diagnosis at a late stage of CKD were linked with an increased risk of complications, underscoring the importance of early diagnosis and management of the condition. Screening is vital for timely detection of kidney disease, as early stages typically do not produce symptoms. It is recommended to undergo blood and urine screenings annually if you have any of the risk factors previously mentioned, especially hypertension, diabetes, or heart disease. For individuals with type 1 diabetes, screening for CKD should start 5 years after their diagnosis. And for those with type 2 diabetes, screening should begin at the time of diagnosis. Blood test. Blood tests include measuring serum creatinine levels. Creatinine is a waste product produced during normal metabolic processes. Measuring serum creatinine allows for the calculation of your kidney's estimated glomerular filtration rate, eGFR. As eGFR decreases, creatinine levels rise, indicating that your kidneys are not effectively filtering waste. Another blood test, blood urea nitrogen (BUN), measures your kidney's ability to filter waste. However, serum creatinine levels are a more reliable indicator of kidney function, as they are less likely to be influenced by other disease states or dietary changes. For example, malnutrition and starvation can decrease BUN levels, while dehydration and high protein intake can increase them. Fever, burns, heart failure, bleeding within the GI tract, and urinary outflow obstruction also tend to elevate BUN levels, whereas serum creatinine levels remain stable under these conditions. Urine test. Urine tests for CKD screening involve checking for proteins, particularly albumin. When the kidneys are damaged, albumin, which is usually present in the blood, can leak into the urine. Measuring the urinary albumin to creatinine ratio, UACR or ACR, estimates the amount of protein lost. Indicators of kidney damage include protein or blood in the urine, an abnormal urine microscopic exam, CKD-related findings on kidney imaging or biopsy, electrolyte imbalances, and a history of kidney transplant. For those seeking more information, studies supporting these findings are available via the link in the description box. Treatment options. Since CKD is irreversible, treatment focuses on halting disease progression and enhancing quality of life. This involves medications, other treatment methods, and lifestyle changes to manage symptoms and complications. 1. Medication. Medications may be prescribed to control blood pressure, blood sugar, and cholesterol levels. According to the KDIGO 2024 guidelines, systolic blood pressure should be kept below 120 millimeters Hg. The KDIGO 2022 guidelines recommend maintaining HbA1c below 6.5% for individuals in stage 1, CKD and below 8.0% for those in stage 5. If your levels fall outside these targets, your doctor will prescribe the necessary medications. However, with CKD, it is crucial to be cautious about other medications you may be taking, as some can further harm your kidneys. Common drugs that may negatively impact kidney function include non-steroidal anti-inflammatory drugs, NSAIDs, like ibuprofen and proton pump inhibitors, PPIs, such as omeprazole or esomeprazole. Lifestyle changes. Lifestyle recommendations for managing CKD include engaging in regular physical activity, following a healthy diet, and quitting smoking. Aim for at least 150 minutes of moderate intensity exercise each week. A healthy diet involves increasing your intake of plant-based foods and reducing ultra-processed food consumption. Maintaining a healthy weight through diet and exercise is essential. Additionally, avoiding tobacco products can lower your risk of developing heart disease, lung disease, and cancer. Our channel features many videos that provide simple lifestyle and dietary tips for managing kidney disease. These videos cover foods to avoid, foods to prioritize, and show how small changes can significantly improve your health. Be sure to check them out for practical, evidence-based advice. Renal replacement therapy. The decision to proceed with renal replacement therapy, such as dialysis or kidney transplantation, is made collaboratively between you and your doctor. While there is no strict cutoff point, several factors influence this decision. Typically, renal replacement therapy is reserved for stage 5 CKD, also referred to as end-stage kidney disease, ESKD, or kidney failure. According to KDIGO 2024 guidelines, planning and preparation should begin when the eGFR falls below 1520 ml, min 1.73 square meters. Dialysis is an effective method to sustain kidney function, with two primary types available: hemodialysis and peritoneal dialysis. Hemodialysis involves a machine called a dialyzer, which filters the blood. Blood from a vascular access point circulates through the machine's tubing, is filtered across special membranes, and then returns to the body. Each session typically lasts about 4 hours and is usually performed 3 times a week, though this may vary depending on the patient's needs. Peritoneal dialysis uses the peritoneum, the natural lining around the abdominal organs, as a filter. A catheter is surgically inserted into the abdomen. During each session, dialysis solution enters through the catheter, remains outside the peritoneum, pulls waste from the blood, and then exits through the same catheter. Treatment for CKD can be extremely costly. In 2020, Medicare spending for individuals aged 66 and older with CKD totaled $75 billion, with an additional $50.8 billion spent on those with end-stage kidney disease. These figures underscore the significant financial burden associated with CKD, beyond its debilitating physical impact on patients. While we have discussed both the financial and physical challenges posed by chronic kidney disease, it is equally important to emphasize the value of preventive measures to lower the risk of developing kidney disease and the need for dialysis. Prevention. How can you prevent kidney disease and avoid dialysis? Maintaining a healthy lifestyle is the safest and most cost-effective approach to preventing and managing chronic diseases. This involves following a balanced diet, engaging in regular physical activity, quitting smoking, managing your weight, and minimizing alcohol consumption. Additionally, it's crucial to attend regular follow-ups with your doctor to monitor your kidney function. In summary, chronic kidney disease is diagnosed when abnormal kidney function persists for 3 months or more. Early signs of CKD include foamy urine, blood in the urine, frequent nighttime urination, reduced urine output, and flank pain. CKD presents a significant global health concern due to its risk of cardiovascular complications and potential fatality. Most individuals with CKD show no symptoms in the early stages, leading to delayed diagnosis and increased risk of disease progression and complications. It's important to stay aware of underlying risk factors, such as hypertension and diabetes, which heighten the likelihood of developing CKD. Recognizing early symptoms and taking appropriate steps can help mitigate damage. Adopting a healthy lifestyle and undergoing regular screenings are crucial strategies for reducing your risk of developing CKD or preventing its progression to kidney failure requiring dialysis. A heartfelt thank you to all our subscribers and viewers. Your support motivates us to keep sharing valuable content. Don't forget to hit the bell icon and turn on notifications so you never miss a life-saving video. If you feel your kidneys may need extra care due to unhealthy habits, check out the video on the screen. We share the top 5 fruits that can help cleanse your kidneys and tips for getting the most out of them. Stay informed, stay healthy, see you there.